I've received the letter. Why should I get tested, and do my family need to be tested?
Patients who've been sent letters have been provided with an explanation of the situation, a set of questions and answers sheets, a free phone information helpline number, and a link to information available on the NHS Lanarkshire website. Patients who've been sent letters have been identified as having been admitted to hospital under the care of the healthcare worker and having undergone a surgical procedure associated with a possible risk of transmission of infection. The risk of a patient being infected has been assessed as being low. We're recommending that all patients who have been sent a letter arrange to have a test for hepatitis C, a blood test that would be carried out at one of the clinics that has been arranged. Having a test will provide reassurance to those who test negative, which will be the vast majority of people who are tested. For the small number of people who test positive to the initial test, a further test would be carried out to see if the person has infection. If they do have infection, they would be referred for specialist assessment and treatment by hepatitis doctors and nurses. Treatment for hepatitis C is highly effective with a cure rate of more than 95%. Family members of people who have been sent letters do not need to be tested as part of this patient notification exercise. Should a patient be identified as having been positive for hepatitis C infection or currently being positive, further assessment of the patient and their family would be undertaken. The key messages that we wish to communicate to the patients who have been sent a letter are that the risk of being infected with hepatitis C is low, that we're recommending that patients who receive letters arrange to have a blood test, and that treatment for hepatitis C infection is highly effective with a cure rate of more than 95%.